During the first panel, we talked about what would happen if the Healthcare Choices Commissioner loaded up the essential benefits package with a lot of mandates on coverage. My understanding this bill is that the Commissioner will have the ability to regulate both government-run and employer-sponsored health insurance plans. One thing that's yet to come up in the hearing is whether or not this Healthcare Choices czar could unilaterally decide to cover abortion services in this newly formed government-run plan. And I think the President said that's something he wanted to do. If that's the case, that'd be a historic reversal of public policy. And if this government-run plan could be designed to cover abortion on demand and taxpayer funds are used, I think that the cost of health care in this country, if one bureaucrat in Washington had the power to decide what type of health benefits your companies had to provide to its employees, if, for instance, they decided not only abortion but acupuncture and hair transplants and whatever, would employers decide to get out of the health care system?
Well, without taking a position specifically on, I think you pointed to the broad authority this board has to add a long litany of required procedures or treatments, depending on who has the ear of which politician on Capitol Hill and the board. So it's opening a door to an endless list, and I think, Mr. Johnson, you would agree that we've never seen a government program be reduced. It's always gotten expanded. And so at some point, an employer would say, I'll just pay the fine and get out of this business. Instead of trying to figure out how to squeeze my plan, which is a very generous plan, into the square peg of this new mandated government board, required health care benefits package. So it's a real, unknown pig in a poke that we're concerned about, given how wide open this bill has left it to this mandated program.
No, I agree with you. I think they would get out. Mr. Kirsch, you cite the New York Times article as evidence that Americans are completely sold on a government-run health care plan. However, that same New York Times poll also found 63% are concerned their own health care would get worse under a government-run system. 68% believe a government-run system would limit their access to treatment and quality care, and 53% are concerned they would have to give up their own doctor under a government-run system. Sometimes with polls, you got to get past the first question to find a real answer, and I wonder if you would comment on that.
I would love to. In fact, the whole thing about a poll is if you'd ask the negative question, you'll get that answer. So we actually did a poll back in January to find out what happened in real debate. And I think you'll see from the questionings, we didn't pull our punches. So let me give you some examples of the questions we asked. The first one was, a public health insurance plan will force people into lower quality care, including long waiting times and rationing of care, which is the argument that we hear oftentimes from folks on your side of the aisle, versus a public health insurance plan will provide people the choice of an affordable plan that includes at least the same benefits as members of Congress get, including a wide choice of doctors. That argument wins by 38 points. Let me go on. We hear this cost-shifting argument. Like Medicare and Medicaid, a new public health insurance plan will reimburse doctors and hospitals at much lower rates, causing many doctors and hospitals to shift costs into people who buy private insurance, versus a public health insurance plan be able to control overall health care costs for everyone by using its purchasing power, like the Veterans Administration does now, to drive competition and lower the prices paid for health care services and prescription drugs. People favor that argument by 45 points. Well, let me do one more that we also hear from people who oppose the plan. Establishing a government health insurance plan will mean that millions of people will lose their private health insurance coverage because employers will drop their private insurance and dump people in the public plan, argument that members on your side of the aisle have made oftentimes today, versus the argument under the current system, millions of people are already losing their health coverage every year. Having a choice of public or private health insurance plans will make sure that Americans always have an option for quality, affordable health care. Americans side with that argument by 47 points. So we did this poll to find out in a real debate where Americans hear both sides of the arguments, where they come down. We thought we might win these by a little, might lose some of them. We won every one of them, mostly 30 to 40, almost 50 points. And so the first question is where Americans want. Choice isn't complicated. People like a choice of a public or private health insurance option, and the choice should be not a member of Congress's choice. It should be a choice that each person makes.
Well, I think you got the member of Congress thing backwards. We don't get free health care by any stretch of the
This isn't free. People are going to
imagination.
pay based on what they can afford.
Thank you, Mr. Chairman. We're out of time. I yield back.